All right, Todd, thank you. It has been 3 years since the first case of COVID-19 was confirmed in the state.
While we are no longer in lockdown or a state of emergency, the virus still impacts our lives. Joining us now is Dr. John Crane, infectious disease expert from the University at Buffalo. Dr. Crane, thanks for being with us this afternoon.
Oh, you're welcome, Dave and Jordan.
All right, so let's talk about what we've learned, what we can do better. Of course, the biggest thing that people probably remember, of course, is the widespread shutdowns in those early weeks and months of the pandemic. Do you think that was necessary now looking back and having that sort of benefit of 2020?
Well, some of them probably were, like the some of the closures on restaurants and bars and so on. I think a lot of people are still wondering whether we did ourselves more harm than good by closing schools, but they probably needed to close for at least a couple of weeks while we tried to regroup and try to figure out what we were going to do. You remember in those early weeks, we really were making it up as we went along.
And actually, I do want to follow up on that because I feel like we were in sort of the dark in those early weeks. I remember that sort of mid-March and then, of course, March 20th and then on and on. Was it that we really just didn't know what we were dealing with? So it was time at that point to just shut it down and figure it out.
Yes, because remember in those early days, we thought that a lot of the virus might be transmitted by touching inanimate surfaces. Remember, schools were being closed and they were spraying down the lockers and the floors and the hallway walls and things like that. Those that turned out to all be wasted, unneeded things, because the virus is transmitted through the air 99% of the time.
And, while we're talking about what we have learned, as we're 3 years out, this is still something that can change and evolve. How prepared would you say we are for the future, whether it's for a new variant or a new virus altogether?
Well, that's a good question, Jordan. You would think that after having come through 3 years of a pandemic, we would be better prepared for a future one, but I'm not sure that we are, because during this pandemic, we had a lot of nurses and healthcare workers who resigned or took early retirement. People who worked in nursing homes decided that they would rather go work somewhere else, like in a fast food or in a grocery store. So our hospitals are understaffed, our nursing homes are understaffed. Public health positions haven't really been reinforced. So I don't think we're really in any better position than we were at the beginning of the COVID-19 pandemic.
What do you think it's going to take to rebuild the medical care system in this country? Because you're exactly right. Every hospital, every nursing home just about is dealing with those staffing shortages.
Yeah, we need continued attention from our government. There's a few things that we can do, that the government can do. The hospitals have to continue to try to train and rehire nurses, nursing assistants, LPNs, all those people that we need. Try to recruit people into public health professions and infectious diseases, which has taken its own blows. So yeah, these are things that we need to do over the next 1 to 2 years.
And when looking at current vaccines and treatment for COVID-19, how would you rate the effectiveness, how far they have come in these 3 years?
Well, the virus continues to evolve, but the mRNA vaccines that were brought out do seem to have worked pretty well, better than the conventional vaccines, way better than the vaccines that the Chinese government rolled out for its own citizens. So the mRNA vaccine technology is one of the high points of the COVID pandemic. People are hopeful that using mRNA vaccines, we can greatly improve our influenza vaccines, for example, which have been mediocre in their protection over the last several winters. And also there's a potential for anti-cancer vaccines to be developed based on this technology, although that's probably, several more years in the future. But these are all things that we learned from COVID-19.
And good that we were able to at least learn something from it, because it did impact our daily lives for some people 3 years. So Dr. Crane, thank you so much for joining us this afternoon. We obviously could be speaking about this for the whole half hour, but we aren't able to do that today. So thank you. We appreciate it.
Okay. Thank you for having me.
Coming up next.